Okay, Nursing Care of the Growing Family. This is Emily Peters, recording Unit 5, Lecture 5 on newborn nutrition. These are some objectives and discussion we will do in class. So, recommended nutrition by the AAP, or American Academy of Pediatrics, is that we exclusively breastfeed for the first 6 months of life. That's the ideal nutrition. However, we know that breastfeeding doesn't always work, so we need to do some sort of iron fortified formula up until that first year of life, and then not introduce any types of solids or iron-rich solid foods until 6 months of age, give or take. No cow's milk can be given before the age of 1 year. So if you aren't breastfeeding, you need to do iron-fortified formula. We also need to make sure that we're not starting those iron-rich solid foods until about that 6 months of age, like I was saying. However, some doctors may say you could do it a little bit sooner. Breastfeeding is technically only beneficial for about a year, nutrition-wise. However, some people will go longer than that. So breastfeeding. About 50% of babies are breastfed. I believe these numbers are changing. I believe it's going up a little bit more. The mother who breastfeeds is typically a multi-para, college educated, has a higher income. Typically not employed away from home, because once you're employed away from home, you're not home as much to breastfeed. They say the western states. Those infants tend to be of normal weight, and these moms tend to not be involved in WIC at all. So, what are the benefits and disadvantages? Benefits for the infant. This is the best food, or the most ideal food for human babies, and it's very easy to digest. It enhances the maturation of the GI tract, provides antibodies to that baby, and cell-mediated immune factors, so it helps give that baby some extra immunity factors until all those immunizations can be given. There is shown to be a decrease against allergies, ear infections, a decreased risk of death from SIDS, better bonding, lower body weight index as the child grows, things like that. It also supposedly protects against childhood lymphoma, insulin-dependent diabetes, obesity, atherosclerosis. And there is some studies saying that babies that were breastfed have an increase in their cognitive development. Maternal benefits. It decreases ovarian, uterine, and breast cancer. It promotes that involution of the uterus, so it allows that uterus to contract and get back to the place that it was before birth, or before pregnancy. It allows that mom to return to that pre-pregnancy weight faster. It enhances that bonding between the mom and the infant, and has very minimal costs, unless you decide to be doing some pumping and things like that. One thing to remember related to breastfeeding is that it's a personal choice. If that mother is kind of iffy, we don't want to force her to breastfeed. This person, the family that wants to breastfeed, needs to make sure it's a decision that they're willing to do 24 hours a day, 7 days a week. They need to feel good about this decision, because it takes a lot of time and effort of that parent. It decreases some of the mothers and fathers' times together. It can cause some stress on marriage at times. Sometimes it doesn't. But it's a big commitment for that mom and that baby. So if there's any wish-washy, if that partner isn't supportive of the mother breastfeeding, it can cause the breastfeeding process to not go as well. Disadvantages of breastfeeding. There's cultural disadvantages. The mom is going to need a lot of emotional support. She's going to be missing a lot of sleep. I mean, she's going to be the one that has that baby attached to her, essentially. She can't go very far. There's the factor of mom needs to be watching how she eats and making sure she's eating enough and getting a wide variety of food in her diet so that she's maintaining calories that is needed to produce that breast milk for that baby. She can't be resentful. Some other disadvantages is mom that's want to breastfeed and their baby is sick and needs to be in the NICU. That can cause some problems for the bonding in the processing of breastfeeding. However, a lot of NICUs out there nowadays are working on that bonding and making it possible for those parents to breastfeed and be at the bedside, unless for some reason that the baby can't breastfeed. But when orally breastfeed. So what we need to do is work with that mother on the pumping so that milk supply stays to where it needs to be. Some medications do not allow you to breastfeed because the medications aren't safe for the baby, or certain medications could decrease the milk supply. Okay. Surgeries, things like that could make it a disadvantage. So some things with lactation. It decreases estrogen and progesterone and increases prolactin. So prolactin is released by that sucking and emptying of the breast. The supply meets demand. Okay, so when we're breastfeeding, it's a supply-demand type of thing. So the more milk that the baby drinks off of the breast, the more is produced. So if that baby is not breastfeeding well and not emptying the breast, then it's going to decrease milk production. Also, in that situation where that baby's not able to breastfeed and that mom wants to have milk, if she doesn't pump to keep that supply and demand going, she's not going to end up having breast milk being produced when that baby's ready to breastfeed. So that's something to kind of think about as well. Oxytocin is released during that injection of the milk, or the letdown reflex, and that helps with that ability for that body to get back to normal. That reflex, or that letdown, is also triggered by thoughts, sights, sounds, and odors. Prolactin and oxytocin are those mothering hormones. So, for instance, that mom that's not able to be there with her or not able to physically breastfeed her newborn because of being in the NICU or whatever the situation may be, it's very beneficial for maybe that mom to be pumping in the same room that newborn is, so she can be smelling her baby, she can see her baby, she can be thinking of her baby. She could even be holding her baby while she's using the pump, because of that bonding that's going on. Moms that have to go home while that baby is in the NICU, I recommend them taking a blanket so they have the smell of the baby. They can lay it over their breast, or they can have it next to them when they're pumping, having that picture of the baby with them, so they can be having those positive thoughts of their child while they're pumping, and that should help with that oxytocin and prolactin releasing and help with that the pumping effects when unable to breastfeed. Colostrum is that first milk, or that discharge that's coming in right after birth. It's very high in immunoglobulins, has lots of protein, and it helps with that bilirubin binding, so breaking down of that bilirubin. It is a laxative, and so it helps pass that meconium. And then breast milk doesn't come in until day 3 to 5. We also have foremilk, which is that early milk in the breastfeeding process. It's about the first third of the feeding. Then you have hind milk, which is a little bit more fatty and a little bit more protein, and that's in the last 2/3 of a feeding. we need to make sure when we're feeding this baby with breastfeeding that we're anticipating the feeding. So is that baby rooting? Is it sucking on its fist? Is it moving around? And then we can go in and making sure it's a good breastfeeding attempt and working on positioning and latching. One way to find out if latching the baby is ready for it is to tickle their lip with the nipple or just the side of their mouth to get that rooting and to see if they're ready. Then we sometimes wet the nipple with milk, so you can manually discharge a little bit of milk, or if you still have some milk that because you pumped, you can just put take a little syringe and put a few drops of that pumped milk on your nipples. Now remember, you want to make sure it's been an hour or longer from pumping to breastfeeding, because if you've just pumped, there's not going to be milk. But you can store pumped milk in your fridge. And then wet the nipple and then bring that baby to the breast if they're showing those signs. And then that will help with the processing. So the next few slides are going to show you some positionings. This is the football hold. So you have that baby whose body is along the side of the mom's body with its butt and the feet to the back of the chair. And then that head is kind of right underneath of the breast, and they can just kind of pull it up and have that baby latch on from beneath and coming up and over the breast. And then you can just control that baby with one arm. And that gives you another hand that can then allow you to hold your breast with a C and to have that nipple pop out a little bit more and guiding and supporting, so the baby's ease of breastfeeding is better. This is a lying down method, so you're laying on your bed, somewhat on your side, and the baby is side to side with you, and breastfeeding that way. You typically have a pillow at your back, so you're somewhat elevated, and you can prop yourself up. Just remember, when you're breastfeeding the baby, you want to make sure the baby's spine is in an alignment and in a straight line. Because if it is curved or twisted or any of that kind of stuff, that baby isn't going to eat well. Think about it like when you're sick and you're in bed and you're kind of crunched up and in a weird position, you're not wanting to eat. But you feel better when you're able to sit up straight and do that kind of thing. It's similar with the baby. Okay. The side line, you're able to pull the baby close to you, lining that baby's mouth with your nipple, and then you're able to lay back and breastfeed comfortably. Cradle is another way to breastfeed, and you're cradling that baby in the arm closest to the breast. So the baby's head is in kind of like in your crook of your elbow, and then you're having your arm go under the butt, and you're holding the baby that way. And that also allows for one hand to control your breast and support everything. And your tummy is together with the baby's tummy. Once again, with the cradle position, you need to make sure that that baby is in alignment. You can do cross cradle when the baby's head is supported with the opposite arm. So this is an example of cross cradle or across the lap. So that baby's turned and the butt is kind of in the crook of your arm, of the opposite arm, and then your arm closest to your breast is supporting. This is a comfortable position for some. Some this does not work as well for. So here's a good view of a good latch. The drawing is. We want to make sure most, if not all, of that areola is in the baby's mouth. Now remember, some women have very large areolas and very large nipples, and so that baby may not be able to suck all of that areola in. But we want to make sure that full nipple and the majority of that areola is pulled into the baby's mouth. If they just have the nipple, it's going to be very sore. The picture of the mom and the baby, it looks like she is manually discharging a little bit of her milk. And then she's going to get that baby up, doing that cradle position. The latch method is a way for you to find out how beneficial your breastfeeding attempt was. The higher the score, the less nursing intervention or the less help is needed. So that allows the nurses in the mother-baby unit to know if we need to get some extra help for you. So latch is the mom's view on how well that baby latches onto the breast. A is the audible swallowing. Can you hear that swallow? The nipple type. Is the mom's nipple inverted, extra large, small, things like that? How comfortable that mom is. And then if that mom feels like she needs a lot of help. Okay? We want to make sure that we get the mom very comfortable with the positioning and the latching, because if she's not, the breastfeeding attempt is not going to go well. The success for long-term breastfeeding won't go well as well if we don't get that good initial help for that mom. And this can be a challenge if you are in a very busy unit and you don't have the extra hands to give that mom the help she needs. A lot of units have lactation consultants Mondays through Fridays. Some even have some that are on the weekends. And that lactation consultant could be that person to come in to help with some of these, as well as using your nurse. So know what your resources are at the institution you're working on, and make sure you use those so that mom can have that good, successful breastfeeding and be as comfortable as possible before going home. So, how often should we breastfeed? They say that they should breastfeed every 8 to 12 times, or about 8 to 12 times per 24-hour period. So anywhere from like every 2 to 3 hours. Every 3 hours is a good goal for awakening that child. Those first feedings after birth are not to satisfy hunger, but to satisfy and establish that sucking reflex. Remember, breastfeeding is an on-demand thing, so we don't want to have a rigorous schedule. So if that kiddo wants to eat every 2 hours, let that child eat every 2 hours. We don't need to have it strict, because one time that kiddo could get tons of milk and go 3 to 3.5 hours. But the next time they may not eat as well and need to eat in 2 hours. Okay, the average duration of a breastfeeding is 30 minutes or 15 minutes for breast. I've heard some people say 10 minutes per breast. Okay, so we're just kind of working with them and seeing how satisfied that baby is doing. Typically that first 10 to 15 minutes of breastfeeding is like your main meal. And then you go on to the second breast as a dessert. So they may not eat as well or as long on that second breast. So that's when sometimes pumping comes in. So if your child only breastfeeds for like 5 minutes on one breast but 15 minutes on the other, you may need to pump the other side, because that helps with supply and demand on each breast. Supplementation is not needed in most cases, okay? So if the mom has a good breast supply, the baby is breastfeeding well, things like that, she should have enough milk to not need to supplement. However, some women naturally do not produce a lot of milk, so they may need to supplement with some breastfeeding. But remember, it is not common to have to supplement with with formula after a breastfeeding attempt. So, some beliefs and studies out there. Supplements can cause nipple confusion. I've been a nurse for 12 years, 11 years in the NICU. I don't believe in nipple confusion per se, but there are some people that have that belief out there. Supposedly the baby implants quickly to the nipple used for the first feedings. The mechanism for sucking in the breast versus bottle is different. So when you're sucking on a bottle, when you close your mouth, you're closing off the flow of the milk. But when you're sucking on a breast, when you're closing the mouth, that is actually what's pulling the milk out. So when you're opening your mouth on the breast, that's what stops the milk from flowing. So the way it works is a little bit different. However, these babies do very well with flipping between back and forth. But I do say that if that mom is wanting to establish breastfeeding, she should breastfeed exclusively as much as possible that first week or so, so that she can get comfortable with that baby breastfeeding. So if she does want to do some bottles, I would say wait off for a few weeks. Okay. They also say not to do a pacifier for the first few weeks of life. However, pacifiers are proven to help with SIDS and also consoling and different things like that. Okay. Pumping. Some things. I've mentioned pumping throughout. Breast pumping can be great. Breast milk can be stored safely for about 5 to 7 days in the refrigerator. Otherwise, it needs to be frozen. In your general refrigerator freezer, it's only a few months that the milk is good for. It's like 3 to 4 months. But like a deep freeze, like those great big giant ones that most people keep in like their basements that are just strictly solely freezers, those they can last for 6 months to a year. But remember to mark what your dates are so you can rotate that milk and use the oldest stuff first. When breastfeeding, we need to not only worry about how the baby's eating, but the mother's diet. The mom needs to take care of herself. Her diet, she should have at least 500 extra calories a day of food, continuing her prenatal vitamins as well. Now, avoiding spicy foods and things like that, because that can also pass through the breast milk and upset the baby's stomach. I've heard some people with broccoli, things like that. So the mom needs to watch what she's eating and see how the baby tolerates. And she also needs to make sure she's eating or drinking a lot of fluids. So we say 8 to 10 glasses of water a day for anybody. Well, that mom needs to drink at least that 8 to 10. She should probably be doing more than that. They say like 2 to 3 quarts per day of water. Because if she's not taking enough water in, then she's not going to have enough water to help with the breastfeeding and producing of that milk. Alcohol. Alcohol should be used with caution. There's been several studies out there saying 1 glass a day is okay. There's been some saying any amount of alcohol is not appropriate. If the mom is going out and binging and going out and having a great time, which she deserves to do, and having multiple alcoholic drinks in a few hour period, she should probably pump and dump. If she's only had 1 alcoholic drink she's probably okay. Medications. Most meds are safe. However, there are some that passes that could not be safe. So just kind of clear that with your doctor, and they will work on what's going on. So most times she should continue taking her prescribed medications. Decreasing caffeine, because that decreases your water output, makes you dehydrated. She should do good exercise and get her 7 to 8 hours of sleep. Okay. Breast care. All she needs to do is wash her breast with water throughout the day. Now, when she takes her bath, she could do a little soap and then make sure she rinses off really well. If her nipples are sore, she can use some lanolin. Typically, if there seems to still be some lanolin on the breast when they go to breastfeed, I typically have them just wipe it off with some water. Hydrogels help with sore nipples as well. It's just like a jelly, coolie pad that you put in your nipple, or in your breast, or in your bra, and up against your breast, your nipples. Breastfeeding shells. So if somebody has an inverted nipple, meaning that nipple kind of stays like inside the breast and doesn't pop out, they recommend putting breast shells inside the bra. What it does is it's like a pressure, and it has like a little hole in it, and it fits around the nipples, and with the bra, it pushes on the breast and allows that nipple to pop out a little bit more. And then it'll be a little bit more erect and available and easier for the baby to latch onto. Remember, you can use breast pads if the mom's leaking, a very supportive bra, things like that. Also, remember, when you're breastfeeding, it does not mean you are not going to get pregnant. It is not a form of contraception. So you still need to take some sort of birth control pill if you do not want to get pregnant. Some sort of hormonal agent that to help with that process. However, remember that these hormonal agents can decrease that oxytocin and and decrease the milk production, so it could cause some issues with breastfeeding. So some things that can occur with breastfeeding is engorgement. This can occur within 3 to 5 days after birth. The breasts are very firm, they're hot, and they're painful. What you need to do is increase your feeding attempts because that helps. It's typically temporary. You can put ice packs, frozen peas, corn, things like that, and take like NSAIDs like Tylenol. When your nipples are sore, watch how that baby's latching because maybe that's part of the problem in that position. You can apply ice for 1 to 2 minutes prior to feeling. Tea bags. Put it slightly over that as long as they're not hot. Let them cool a little bit for a couple minutes. Is the baby eating enough? Is it sleeping good? Are we still having 6 to 8 wet diapers? Are we having bowel movements? Things like that. That shows that it's not the baby not emptying out your breast. Are you burping? Things like that. You can also do like cabbage leaves to help with it. Massage in your breast, making sure you're emptying, so maybe pumping after breastfeedings, things like that. I've also been told that breast milk helps with sore, cracked nipples and things like that, so make sure that you expectorate a little bit of that breast milk and rub it over your nipples, and it should help because you have all those antibodies and things in breast milk. Some other things when you're breastfeeding, are they doing both breasts? Are you burping in between? Babies will sometimes spit up. Spitting up is okay. Is that baby gaining weight? The baby will have growth spurts at 10 days, 3 weeks, 6 weeks, 3 months, and 6 months. So they may feed a little bit more frequently during those times. Bottle feeding. They recommend bottle feeding every 3 to 4 hours. Formula doesn't break down as fast. Therefore, the baby tends to stay fuller longer. When you're bottle feeding, make sure you're still having that bonding with that baby. So encourage the holding and cuddling because that can be a downside to bottle feeding, propping the bottle, things like that. So just making sure you're doing things to continue with the bonding. Make sure there's no air in the nipple because air in the nipple can cause stomach irritability and things like that. We won't start solid foods until about 4 to 6 months of age. The baby's body isn't ready to start digesting those complex foods. Once again, just kind of follow what your doctor recommends. Positioning, not laying the baby flat typically, not having them crooked, things like that. How that bottle is positioned with the baby is in a line, like at a 90-degree angle. Is there, the nipple completely filled or that air in the nipple? Make sure that you are mixing that formula properly. So if you follow the directions on the bottle, because if you're putting in too much water or not enough water, you can cause nutritional deficiencies with that baby. Formula is very expensive, and so people sometimes water it down to make it extend longer. However, water isn't good for babies, and it actually can cause major fluid and electrolyte imbalances. So we don't want to have watered down formula. And the opposite goes for if you have not enough water, then the formula is going to have more calories than the baby needs. And then that can cause some other issues. You're going to slowly drink as you start introducing solids to the baby, they probably will be eating a little less formula. So once again, just kind of watching how much you mix. When you mix formula, it's only good for like 24 hours, and then you have to toss it out. So only mix up enough milk for a couple feedings. Also, don't put more in the bottle than what you need, because once that baby sips off that bottle, it is contaminated and a good source for growth. So you only want to put a few ounces in the bottle at a time, and you can always put a little bit more as that baby eats. And we'll go over these in class. And that is the end of Unit 5.